Okay, we're going to get started. So welcome to everyone. This is the third in our Healthcare is a Racial Justice series, and our topic tonight is the role of faith communities in dismantling white supremacy in the U.S. healthcare system. My name is Michael Baer, and we are joined by Dr. Shawnee Daniels-Sykes, who is Professor of Theology, bioethicist, registered nurse. She teaches at Mount Mary University in Wisconsin, and Ralph McCloud, who is the Director of the Catholic Campaign for Human Development at the United States Conference of Catholic Bishops. Thank you to both of you for being here this evening.
Thank you. It's a pleasure to be here.
Thank you for having us.
So we're going to jump right in, and our first two sessions of the series have focused on naming some of the ways in which structural racism is embedded into the U.S. healthcare system. Dr. Shawnee, what does Catholic social teaching have to say about systemic racism and the moral demands on us of those of us who call ourselves Christians?
Yes. You know, unfortunately, if one were to look at the 1979 pastoral plan, Brothers and Sisters to Us, and even the most recent one in 2018, Open Wide Our Hearts, there's really not a very strong, sustained analysis, moral analysis of the term systemic racism. It may get mentioned, but really, when we're looking at Catholic social teaching, especially those pastoral plans from the United States Catholic Conference of Bishops, there's really an individualist perspective that undergirds racism. So it's me against you, having a prejudice or a racist attitude towards you or discriminatory attitude towards another. We forget, though, that racism, when you're really looking at naming one who is superior as opposed to one who is inferior, whites are superior to blacks, blacks are inferior, that this has a long, long history of entrenchment. We can say that America's original sin of African chattel slavery was grounded in an ethos that kept people of color, dark-skinned people, as 3/5 of a person, that they were animals, that they could be treated as property. And so as those hundreds and hundreds of years with that kind of mentality, keeping people of color, black and brown bodies away from the decision-making tables, and even being used as specimens for learning different techniques in healthcare, that an attitude, a perspective, a bias, both explicitly and implicitly happens that becomes systemic. And I don't think that Catholic social teaching has really done that sustained analysis, especially in light of healthcare. And so I just want to argue that even though the Catholic Church speaks anti-racist, non-racist, that we still have a long ways to go in terms of using principles, themes that undergird our in papal encyclicals and church documents, our themes of human dignity and community and participation and rights and responsibilities. Those are abstract principles that need a lot more meat on them as they are, as an analysis, a moral analysis is done to look at the huge and longitudinal issues of race and systemic racism.
Thank you for that. And so you said it, there's a lot more work to be done. And you also said that, that frequently we're talking about abstract principles.
Mm-hmm.
And yet this isn't just about abstract principles. Ralph, this is about individuals with names, with stories, with families. You wrote a reflection on the power of reflecting on the fact that Jesus wept at the death of his friend Lazarus. What does it mean for those of us who take the incarnation seriously to pray on how Jesus weeps at the treatment of black and brown bodies in the United States today?
Yeah, I think it's important to remember that Jesus was a healer that healed physically and healed people who were emotionally ill, and he heals without asking for insurance cards or asking if folks are worthy or if there's any kind of collateral, or without asking if the ill or the infirmed person is a part of any community or sorority or fraternity, but he just healed. And in fact, to help us understand that, he preached a parable about the Good Samaritan to inspire us to go outside of our own individual and familiar circles, that we might be able to do some healing outside of that. and that we go to places that are dangerous, that are difficult, and we acknowledge and recognize and find those people who are beaten and barren, often left alone, who might not be of our own families or our own culture, and realize that in solidarity that we're called to assist, to help, and to heal as Jesus did. And ask it, and Sister Shawnee put it so well just now. Ask, what are those structures and those systems that are keeping us from being healthy? What are those structures, those systemic structures that are keeping us from being healthy, and how, and what feeds those structures? And so systemic racism feeds the structures, and racism doesn't happen in a vacuum. If Uncle Ed was racist in his basement all by himself, it probably wouldn't cause the kind of treatment that we see as it relates to some of the structures in our society. So I think that we're called, we're constantly called. And if we look around and look at any pandemic within a pandemic, that within another pandemic, that there's a great deal of healing that needs to happen.
Mhm.
Unquestionably. And so, you know, a follow-up to that, it's not just these individual experiences of systemic racism and white supremacy, but the communal, seemingly ceaseless trauma of being a person of color who wakes up in this country and sees yet another headline about another death, be it at the hands of police with Breonna Taylor, or at the hands of the healthcare system, as with Barbara Dawson, whom we spoke about in last week's session, and or waking up today and seeing that a 42-year-old white Michigan man has been charged with a hate crime for taking a bike lock to the face of an 18-year-old black teenager on a beach south of Detroit and screaming racial slurs. What is the spiritual and psychological trauma and toll on individuals and communities of color through all this, and what role does faith play in it?
Yeah. You know, one might think that the faith has maybe been eroded or marginalized in all of this, but the research that I have been engaged in looking at death shrines that have been erected after deaths, homicides, Black on Black homicides, police killings, that in those homicides and those objects that are in those homicides, one sees some very beautiful faith perspectives. One sees candles, one sees teddy bears, one sees balloons. What I have done in my research is equate those various objects that one finds in roadside shrines, death shrines, that can relate to spirituals, that can relate to scripture stories. And we see people who have built this monument, and we see them all over the place, right? If we pay attention, we see them all over the place. And so for me, it's like, pay attention. This monument is out on the street where a loved one was murdered, killed, what have you. And so our faith and our spirituality have moved to the secular square, not necessarily within the spaces of churches or synagogues or temples. And so that faith piece needs to be followed to where the people are, and to be in that space as people mourn, as people share the stories of what happened to their loved ones, as people keep the death shrines beautiful with pictures and other types of memorabilia that once belonged to that person. And so when I think of the spiritual pieces, if we are attentive to the response to the trauma, the people are really screaming for a sense of, help me to work through this. Here is something, an atonement, a throne that I leave for the world to see, for the public to see, so that my loved one is not lost and is forever remembered as much as possible.
Yeah, that's powerful, sister. I think too that the that faith is an authentic faith is a faith that's been able to soothe and assist us in the trauma of the Middle Passage, the trauma of the Civil Rights Movement, the trauma of enslaved ancestors, and I think it's a authentic faith that we need right now. And I think in all of those cases, the authentic faith was a mobile and an action faith, an active faith. It was something that went beyond the four walls of the sanctuary of the church. It was the faith that was in the streets. It was a faith that it was in the fields. It was a faith that was transporting along the Middle Passage. It was something that could help us through the trauma that we were going through. I think that now, and James Baldwin put it so well when he said, to be a Black person in the United States now and not have any kind of trauma, you're not paying attention, or you're extremely insulated. And Mike, as you were saying, waking up in the morning and watching the news, or walking down the street, or seeing the kinds of things and hearing that all of these systems that were supposed to support us, to assist us, to help us, are created, are built against us, can be extremely traumatic, can be extremely cause folks to live in a sense of despair, and so much in despair that the faith is the only thing that we have to turn to. But it has to be authentic, it has to be genuine, it has to touch us where we are, and it has to be something that's so authentic that we can see it working, we can see miracles happening in our communities, in our families.
One of the things that I get real concerned about those death shrines is the impact, the traumatic impact on the children. Because children, many times those shrines are sitting right in front of someone's residence. And so children are riding bikes or walking around and wanting to talk about their friend. Maybe it's a kid that got shot or hit by a car or whatever. And so to basically be able to process issues around life and death and trauma with children, that's one thing that I'm very concerned about in terms of so much death in our community, and that faith piece being able to be yoked together.
Yeah, Doctor, and something I saw that in Ferguson, in that the where Michael Brown was killed, the street where he was killed, there was two apartment buildings on each side, and young people who came and created this huge kind of shrine in the middle of the street and blocked the streets off, and the young people became somewhat of docents for people when they came by to kind of explain what happened there. But you could to see and witness the trauma, particularly of the youngest ones.
Yes.
Because there was a sense of, what comes next, who comes next. And among the older ones, they were befuddled by the system that had the system that allowed something like this to happen and seemed to ignore them. And they were also befuddled by the over militarization of the city's forces. City forces that had very few resources to take care of their parks somehow came up with the money to bring tanks and armed material, militia type things. Yeah, National Guard and things like that up and down the streets.
Yeah. Thank you. So Dr. Shawnee, you worked as a registered nurse for many years, and you saw firsthand how systems like these systems that are supposed to help people, as Ralph just said, like the healthcare system, can deny Black, Indigenous, persons of color their humanity, and how human life is literally on the line. In your experience, why is it that so many bishops, priests, and other church leaders struggle to see this issue of healthcare as a life issue? Where's the disconnect between an overwhelming willingness to talk about an issue like abortion, to organize marches, to deliver homilies, but a failure to understand issues like healthcare and racism and poverty as life issues?
Yes, thank you. That's a real important question that I continue to grapple with. One of the things that I am pushing for in my own reflection is a change in nomenclature. And that for people who really understand what it means to be pro-life, and I'm really talking about perhaps the Democrats, understanding that pro-life is not just a mere taking care of the life in the womb, which is really, really important, but then advocate for what happens after that child is born and putting the necessary funding, welfare programs, and things like that so that children and family can flourish. We live in one of the richest Western democracies in the world, and we can do that. And I would also advocate that this notion of pro-birth really, really situate itself with people who are just really about life in the womb. And I think if we would argue for a shift in nomenclature and really understand what we mean, we might be able to move the needle forward. I think it would give us a better way, and Joan Titusher talks about this. It'll give us a better way to see how life in the womb is important, but also after birth is important to natural death. And so that's one thing that I'm pushing for in my own reflection and writing, to change the nomenclature. The other thing is when bishops and priests and people like that they're immune from life issues that affect men, women, and children. They don't necessarily have biological families. Maybe they have nieces and nephews and things like that. But really being in that integral relationship to see what healthcare costs and to see that healthcare is a social good. And when we talk about a right to healthcare, it's not just focused on reproductive rights, whatever that means, the contraceptive mandate. So all of those pieces need to have some deeper conversations in terms of giving a social, political, ecclesial analysis of healthcare as a universal right for everyone. And then I also believe that we have a competing conception of social justice, or just justice, because in our secular worldview and our secular ethic, bioethic, we really have healthcare associated with the individual's right. It's a part of work. It's a part of my income. It's a benefit. And so if we're in a capitalist society where we don't want to share healthcare, you can't force me to increase my taxes to share healthcare. And I think so many priests and bishops and many lay people are caught in that web of a struggle, a creative tension. Maybe on the one hand, yes, but then I don't want my taxes increased because of your irresponsibility. And so negative judgments be put on other people because of perhaps their lifestyles. And so it gets really messy. But I think it really does require us to do some different type of bioethical and social analysis of terms, pro-birth versus pro-life.
Right. Absolutely. And I think it's you know, speaking as someone who has worked for the church, I think it's been a failure on our end to catechize people, including, it has to be said, many priests and seminarians who sometimes people are stunned when I tell them that the Compendium of Catholic Social Doctrine, approved under John Paul II, lists universal health care as a human right. And people are blown away by that. And then to hear that Pope Benedict in 2010, who's considered this conservative guy, said that healthcare was an inalienable human right. And so we haven't even heard that preached from our own Catholic leaders. So why are we shocked when we allow the conversation to be framed around secular political, you know, language, right? So yeah. So we have a lot of work to do in terms of getting our own teaching out. But I also want to make clear that there are many people in the church that actively do make these connections and are putting in the work to apply Catholic social teaching to on-the-ground issues related to healthcare, nutrition, education, and other basic human goods. And here we're primarily talking about the Catholic Church because this series is co-organized by a coalition of Catholic parishes organized in anti-racist work along with a Catholic university, Loyola. But obviously this work is being done by many, many faith communities and denominations, so we don't want to overlook or erase any of that. But Ralph, you serve as director of the Catholic Campaign for Human Development. For those who are unfamiliar, what is that, and what's the work you're already doing around this issue?
Sure. Well, the Catholic Campaign for Human Development was founded to deal with the root causes of poverty. And I think especially when we talk about things like healthcare, I think CCHD kind of has a holistic a broader look at healthcare as opposed to just not just the medical aspect of it. The best way I can describe it is maybe an example. I was at a parish not very long ago, and I met a young lady there. She was probably in her mid 60s, and she was very engaged with the activities that were going there. And they were having an organizing meeting and trying to improve things in the neighborhood and the community. And I asked her just why she was there. And she mentioned that she was there because she had a son in prison who was never going to get out of prison because he did a very, very horrific crime. And so I asked her, if this wasn't a particular meeting that had to do anything with mass incarceration or jail or anything like that. And I asked her why she was there. And she said that she was there because she had a memory. She said when her child was very young that he suffered with asthma and ear infections. And she and her husband, between the two of them, they worked 5 jobs. They were immigrants, and they doubled and tripled up with other families. Even with 5 jobs, they couldn't afford their own places to stay. But the asthma and ear infections affected the young person's learning ability and the lack of learning ability. And he got further and further and further and further behind. And they actually treated the asthma with somebody else's inhaler, and it wasn't their own prescription. And he committed this horrific crime, and was sentenced to prison.
Mm.
And she told me, I asked her, so, well, do you have any other kids? And she said, no, I don't have any other kids, but I have a couple of hundred kids. Because she said that every kid in the neighborhood was her responsibility now. I said, do you have any siblings? She says, no, I have no siblings here in this country, but everybody in this country is my sibling now. And I mentioned her particularly in this context when we're talking about healthcare and talking about systems. What if the outreach for the healthcare system was different there in that situation? They were able to find some penicillin and inhalers and some prescription drugs for that young person who could. What if the education system was different? What if the housing situation was different? What if they had affordable housing and they didn't have to live together? What if the immigration system was different and they didn't have to fear of detection and not going to the emergency room? What if the employment system? What if they had jobs where they could have to pay time off and able to take their kids to the hospital, or they had the kind of wages that they could afford to afford their own health care? What if the system was different? The law enforcement was different, and he wasn't able to get his hands on this gun and commit this crime? So all of those systems in many ways fail. And she explained it to me in a way that said, this is the health or the lack of health. And it speaks to a broader a sense of what health is for us.
Absolutely.
So,
And just to go off that, Ralph, maybe you wouldn't mind saying a little more. Pope Francis's 2 encyclicals that he's released, one Laudato Si and the most recent one Fratelli Tutti, they really get into this. These are all interconnected issues as far as we're concerned. We don't take healthcare in isolation from things like environmental factors, like where is affordable housing located in a given urban area.
Right, and in the Catholic Campaign for Human Development's name, and in its name, it talks about human development. How do we develop human beings in a way that they might be able to live up to the dignity that God wants all of us to live up to?
Right.
Not partially, not in a piecemeal, but the human development that says a person can contribute to their own individual families and their communities in a way that's integral, and have participated in community activities and build up their community. What are the things that are missing that keeps that from happening in a way that's holistic and significant? And CCHD has been doing that. We've been doing it right around 50 years, and we fund around 220 community organizing groups around the country, economic development initiatives that help folks with housing and job training and those kinds of things. And but the important thing, and I think the bishops were wise in their foundation, that the organizations, the community organizations that we fund, they insist that the voices of that organization be low income. The boards, the persons who make the decisions, who are the spokespersons for those organizations, the boards have to be over 50% low income. So it's not some sort of patronizing organization from the outside that comes in and tries to say, this is what low income people need to succeed. And it's the voices of the folks themselves who make that determination and eligibility, makes them eligible.
That's wonderful. That's wonderful. Thank you. So I mentioned Pope Francis, and Dr. Shawnee, just last week, Pope Francis released his prayer intentions for the month of October. And this month's prayer intention is that as a church, we would become better about integrating women into genuine positions of leadership. There may be women watching this who are thinking, I would love to make anti-racism work and healthcare access a priority for my faith community, my local church, but the powers that be would never get on board with it. So Dr. Shawnee, what advice would you give to these women? What advice would you give to the men too, perhaps pastors and bishops who are seeing this, who sincerely do want to make sure that women are in roles of authentic leadership around this?
Thanks for that question. That requires some deep theological reflection that brings around sensitivity, and that also pays attention to not only diversity. Diversity, I think, is a word that has been used now in terms of hiring practices and just making sure we have a diverse workforce of men and women and people of color. But what I've been focused most recently on is this whole notion of inclusion. What does it mean to be included? Yes, I am here adding to the diversity of your workforce or your organization, but how am I included? And I can only go back and smile at the documentary Hidden Figures. You have 3 Black women who were hired to work in the space program in the 1960s. They're there, but were they included really? Until later on, after proving themselves. And so we can shift forward and basically say that women and men working in an anti-racist environment, working for anti-racism, it's still going to be an intentional piece. We need to ask, what does this hire do for men and women? What does hiring me to work in this environment do for men and women? What does this hire do to women and men? And how do women and men really participate in it? Okay, and I think through various lenses, as anti-racism, anti-sexism, anti-classism, all those intersectionalities need to be engaged in honest conversation. Even if there is an issue related to restrooms, how do women participate in this conversation? And so we cannot continue to ignore what it means to be included in a diversity hire. Otherwise, we end up having a revolving door and women continue to be deflated or be marginalized or what have you. The other thing that I was thinking about is we have to pay attention to, what happens when, because we are born in a particular society that has a certain perception about women and men, we have power differentials, we have issues related to stereotypes about women, unconscious and conscious behaviors that have become internalized. So how do we learn to undo the untruths? Even mindful that we may have some confusion and hurt, anger, fear, but how do we unlearn the untruths about women of color coming in to be a part of an anti-racist ethos? And so I put all of that there basically to say, yes, I too would love for women to be hired in the context of whatever, anti-racist work, increasing the diversity and inclusion in our workforce tasks, but never, ever, ever to take that for granted. It's just constant dialogue.
Thank you. That's great. And I think that dialogue can only take place if, as Pope Francis says in Evangelii Gaudium, we learn the art of listening. And I don't know that we're always as good at listening. So I guess a quick follow-up to that would be, let's say that I'm a pastor, and I'm not, I'm a layperson, but let's say I'm a pastor who says, I want to take this, I want to run with this. I really do want to integrate women, not just in hiring practices, but in terms of lay leadership in my local church community. But I don't know where to start. What could a Catholic pastor or bishop do to increase that authentic inclusion, which involves listening and does sometimes feel a little scary because I'm the one that's supposed to teach, govern, sanctify, right? Like I'm ordained, I'm the teach, govern. So how do I, if I'm a Catholic or ordained in a different denomination, how do I more intentionally empower women for leadership in a way that doesn't threaten my ordination? It empowers theirs in the baptismal role of the laity.
Right. Surrounding yourself with women and having conversations with them, asking this question of them, and be open to listening to what they have to say. Women will be very honest, I believe, but the person that they're critiquing or sharing or responding to has to have thick skin and realize the women are not out to get you. They're basically helping you to grow. Many women have sons, and many women have done a wonderful job in raising their sons. Many priests and bishops have mothers and sisters. And so it's not like you're in a disconnect, that the opportunity is right there with nieces and nephews and brothers and sisters to get together and have these very sacred conversations. I think we forget that these opportunities are right here for us. And we have to figure out how best to have our allies and to put ourselves in spaces and places where we can have this ongoing dialogue, and not in a one and done thing, but ongoingly.
Right. I think having a thick skin has been something all of our speakers have particularly given as really helpful advice, particularly to aspiring white allies and people who do want to do this work. Develop thick skin, because it's not about you. It's about hundreds of years of systems that are in place that have dehumanized entire cohorts of Black, Brown, and Indigenous persons. So, all right. Related to that, Ralph, you have extensive experience in community organizing, which unfortunately some people think of in terms of political terms, but of course community organizing is what drove the civil rights movement of the 1960s, and much of it, if not most of it, was done through faith communities like churches. But right now it feels like churches, especially Catholic churches, and if we're being really honest, especially predominantly white congregations, not only aren't out there on the front lines organizing for racial justice, there's actually a great deal of fear and distrust. Why should churches be actively involved in community organizing around racial justice? Why should Holy Trinity Parish in DC care about the closing of Providence Hospital? Why should Holy Name Cathedral on the north side of Chicago care about efforts to save Mercy Hospital on the south side?
Sure. One of the benefits, one of the many benefits of organizing, community organizing, is that it brings folks together. It brings a prototype community organizing group would have a parish or a church from the suburbs, from an urban area, from a rural community, all coming together to identify and listen to folk and find out what issues they have that they're struggling with. They spend a significant amount of time listening to one another. And the other beautiful thing about it is that they're not going to necessarily all be Catholic. They're not necessarily going to all be low income, but the reality of them coming together, spending significant, deliberate times listening to the issues that are concerning folk. So you find a Holy Trinity would be joined with another parish from across town who would hear, or another church from across town, or another synagogue, or another mosque from across town who would hear the pain of people who were saying that this hospital is closing, and that the health care of the community is something struggling. And when they're able to come together and build power. Now the parish down the street, St. Anthony's, that's a little small parish, when it goes to City Hall by itself and wants to talk about the hospital closing by itself with maybe 5 or 6 parishioners, and who are very, very loud in their opposition to it, won't get very much attention. But when they come with other folks when they come with several congregations and churches and mosques who have that same interest, all of a sudden they're able to build a degree of power that gets them the kind of respect that they need to get heard in a different way. Organizing is all about organizing money and organizing people. And most of the organizations that we have don't have money. Like I said, we insist on the boards being low income, but we can organize people, and bringing people together to spend some time both in leadership development and studying what the issue is, looking at the signs of the times. And all of them, you know, while there's no proselytization among them, they have a deep appreciation for each other's faith that's really beautiful to watch. They meet in each other's churches, and they kind of have a round robin. And again, there's like 200 of these groups around the country who is doing the kind of the exact same thing, to listen, to hear, to act on what they hear. And it's all relationships. It's all about relationships. I like to say Jesus was the first community organizer. When he saw that he needed a tax collector, he needed a doctor, he needed some fishermen, he needed people from all different, not very many priests or theologians necessarily, but he brought people together that understood folk, that could interact with the folk, and relate to the folk. And I think that's what community organizing does when it's at its best.
And specifically, Ralph, thank you. That's so great. And specifically, what I heard you say in there too was that, you know, if to take the example of a wealthy, predominantly white parish in DC or New York or Chicago or something like that, who wants to undertake some of this work, part of what I hear you saying is it's essential not to show up with this white savior complex, like we know what you need, but to ask, what do you need? To ask, how can we help?
And I think that's the kind of one of the beauties of Francis, to understand the importance of both encounter and accompaniment. The encounter to go and listen to see how can I help? And it may not be anything but your presence. I mean, in many cases we say, you know, even bring your checkbook. We just need your presence. And we need you to walk with us, to accompany us to a city council meeting, to accompany us on a peaceful protest, to accompany us to a district office, congressperson district office, and be with us and walk with us, and show solidarity with us. And we'll do the same for you. And we'll do the exact same thing for you. And once that relationship is formed, you won't allow your sister or brother to be hurt by one of the systems that has been significantly oppressing and depressing folk.
And showing up and being with, accompanying, that's not just new with Francis. Francis has emphasized it, but Dr. Shawnee, I mean, this comes back to this theological concept of solidarity. And Pope John Paul II, I mean, he literally walked arm in arm, talking about community organizing. Solidarity was the name of the movement. You know,
Right.
this is who we are. So Dr. Shawnee, for those who maybe have heard that term but aren't as familiar, what is solidarity from a Catholic social teaching perspective, and what does it demand of us in this moment when it comes to racial justice?
That's right. So we can find the term solidarity in many of the encyclicals, Solicitudos Rei Socialis. We can find it in Laboris Exercens, Centesinos Annos, and even in Pope Francis's most recent encyclical, Fratelli Tutelli. And basically what we're talking about, when we think of each one of us as human beings, created in the image and likeness of God. And with that very premise, we say that God is our father, if you will. God is our mother. God is. And if God is that parent for us, then we are sisters and brothers to one another. Okay? And if we're sisters and brothers to one another, there is this presumed ethos of interdependence. That you are my sister, you are my brother, we are interdependent. It's a virtue. It's a virtue that calls us to goodness. It's a virtue that calls us to honesty. It's a virtue that calls us to faith, hope, love, prudence, fortitude, justice. It's a virtue that really helps us to keep us accountable to this whole ethos of love. In terms of what we are called, if we understand love in its purest form, in its radical form, in its deepest form, we love. We are called to love one another. And so in that solidarity piece, I am your sister, I am your brother. I am interdependent. What happens to you affects me. What happens to me affects you. And ultimately, we are only as strong as our weakest link.
Absolutely. Absolutely. Thank you. And I think, you know, certainly for someone like me, I come back to that the ethics of the scriptures are inherently relational and communitarian, right? They're all about dikaiasunes that they're about what do we owe one another, and it's directly a prophetic challenge to a hyper-individualistic, capitalistic approach to morality and an issue like healthcare, where, as both of you have said, we tend to think of it through this lens of it's related to things like does the person earn a living through a job that provides benefits, whereas, you know, our Catholic faith authentically says health is in terms of these relationships. And it's, I think of a good friend who is a Black woman and a mother who shared with me recently that she got her teenage son a dog so that when he went walking through the neighborhood at night, he would seem less threatening. That is, for me, a white guy, a reality I have never had to worry about walking through a neighborhood where I grew up at night. And so I think that the beginnings of that solidarity is, to both of your points, creating those spaces to listen and encounter and hear stories that are other than what we have heard. And so I thank you, both of you, so much. So kind of like towards the end of our conversation, a favored model of our current Holy Father that is cherished tool by those seeking lasting social change, because we don't want this to just be a one-off series. We don't just want this to be a one-night webinar, is See, Judge, Act. And in this series, we've really covered how some of the realities of structural racial injustice are so deeply embedded in the US healthcare system, and it can feel overwhelming. We're judging, I hope, that the systemic racism is really poisonous. We're at the point people attending webinar on this want to act. We see it, we judge it as bad, but it feels so overwhelming. So my question for each of you is, what is one specific action that people attending tonight's session can take to move themselves or their local church, their local faith community, their pastor towards addressing systemic racism in the US healthcare system?
I can go with, I have a fundamental critique of the pastoral circle of See, Judge, Act.
Okay, yeah.
And it's coming off of Bernard Lonergan. He's a Jesuit philosopher that really talked about experiencing and understanding. And so going to See, Judge, Act in a circle, we see, but this whole notion of understanding can be premature if we don't understand and move to judgment, and just move to judgment. It can be a prejudgment. So my thing is, in this critique of the pastoral circle, is see, understand, judge, and act. And in that understanding, since we don't have good, strong documents, pastoral documents, recent ones, Open Wide Our Hearts, or Brothers and Sisters to Us, or the Church and Racism, that speak strongly about systemic racism, I think we need to understand what systemic racism is. And I think because we are very, very ahistorical in this country, that we don't want to go back 400 or 500 years to see how systemic racism got entrenched into the major institutions of our United States. So going back to 1619, when the first African chattel slaves were bought, or going to the Emancipation or Reconstruction, and then realizing we had the Civil Rights laws, Civil Rights and Voting Rights Act, and then all of a sudden we got an unraveling of those, particularly the Voting Rights Act in 2013, Black Lives Matter, all of that, we're at 2020. We can look at that whole string from 1619 to 2020, that whole line, and basically see what systematic racism has done. And we are only 50 to 60 years in some kind of de facto segregation, if you will, that's being threatened in terms of moving back to de jure segregation and moving back the various civil rights and voting rights laws. And so if we don't understand what systemic racism is from a longitudinal perspective, I think we're lost.
So I hear you saying, and tell me if I'm wrong, I hear you saying that in order to do any of the See Judge Act, it requires ongoing education about the realities so that you can take action. You can't understand why the gutting of the Voting Rights Act in our current era is so problematic until you really understand Jim Crow and poll taxes and things like that.
That's right.
Yeah.
Amen.
Yeah, I think of that right now, that with these these images of the long lines and people saying, isn't wonderful that people are willing to wait 11 hours to vote, and going, why are people waiting 11 hours to vote in a predominantly minority community? Yeah,
right.
Yeah, right,
There you
right.
go.
Yeah, and especially when time is money and jobs are the way we earn our income, to spend 11 hours
in COVID-19.
Yeah. Yeah. So Ralph, same question to you. What is one action people who are attending the series can take moving forward?
It's kind of hard to narrow it to one, but I would say organize and mobilize. And what I mean by that is looking at the signs of the times. And like, my grandmother would say, and even there's an African-American hymn that said, we can't let this harvest pass. That what's happening right now, we look at what's happening, see how we can best respond. Rights happening, we are in the middle of an election season, and parishes and people of faith should be, willing to stand in line and see their votes November 3rd or whenever it happens as not the benediction, but the invocation. It's not the end, but the beginning. It's not the closing hymn, but the opening hymn. It's that it begins that now we're going to hold elected people accountable. That now we're going to make sure that they understand what our issues are, and that we're going to hold them accountable. And I had in my life, I've run for 4 elections. I've won 4 elections. I voted for everybody, every chance that I could since I was 18 years old. You do the math. That's a lot of voting. And I've never in my life have I ever voted for someone who I agreed with totally, including when I voted for myself. I'm confused. But the reality is that there's going to be differences. But I think to insist that church folk bring some of those same values of caring for brothers and sisters in a way that that helps us bring them to another place, and stay in those organized community relational relationships, and be committed to go across the tracks, to go across the railroad tracks and listen to folk. And listen to ways we might be able to address some of these institutions, no matter what the institution is, that's racist, that's causing folks to not live up to their dignity. And I often say that we've marched in the streets, we've even painted some streets, but now it's time for us to move to that next level and start dismantling where possible, to addressing where necessary the institutions that are keeping folks down. I think we have oftentimes have a euphoric experience, and there are beautiful ways that folks have marched throughout the country. Certainly I've done my share of them, but there is something else to be done. There is more work to be done. And that work is acting on behalf of our brothers and sisters, and acknowledging the fact that my poor, unemployed, underemployed immigrant brother who's on the other side of the railroad tracks needs me to walk with him and to encounter him just as much as I need him for my own salvation. For me to be to live out my Christian mission in life, I've got to be brother and sister in a deeper way, and dismantling racism, addressing it in a way that's practicing what we preach in terms of our faith and the human dignity of all of God's children is something that we've got to be about. If pandemic and fires and floods and polarization and political uproar, if this can't do it, if this doesn't get us moving, if this doesn't cause us to mobilize, you have to wonder what will have to happen for us to get to that point. How low must we have to go?
I've loved what you said. I'm gonna butcher your words, but basically saying that in the liturgy of American political life, an inauguration is an opening hymn, not a closing hymn. I love that. That the work is just beginning. All right, so final question to both of you. We'll get you out on this. We get this question at every kind of panel we do of these things. And the question is, what gives you hope? And I want to be very clear for those who are not familiar with the theology of hope. It is not this naive optimism that things are magically going to be better because of the outcome of an election or because of it is not naive. It is theological virtue of hope. What gives you hope in the current moment?
As a very devout Catholic, paying attention to the paschal mystery of Jesus's life, his ministry, the countercultural world that he lived in that was a threat to, at the beginning of his life, it's a threat to King Herod, a threat to the society at large. Jesus's ministry and his convictions of living a countercultural life caused him to be murdered, caused him to be spat upon, caused him to die. But it didn't end there. As Easter people, we believe in the resurrection. And in that resurrection, there is hope, and there's joy, and there's fulfillment, and there's a cycle of life. We experience the paschal mystery of our lives each and every day. And to be attentive to that is just really beautiful.
Yeah, I don't know how to top that. I would say that for me, it's much simpler. I've, like a lot of you, I'm sure, gone to a lot of demonstrations and a lot of protests. But the last few that I've gone to, particularly here in Washington D.C., I am struck and inspired, I guess, by the demographics, the population of the folks who are there. I'm struck by their tenacity and their dedication. But a little 11-year-old girl, white girl came up to me and said, her words basically like, "What can we do to help?" And she was there with with both parents. I don't know if her parents sent her over to me or what, but I was just one of the participants, just one of the walkers. And I don't know if I was looking confused or whatever, but she came over and asked, "What can we do to help?" So that suggests a couple of things. One is that she's on the right track. The other thing is that possibly her parents put her on the right track. More than likely that's what happened. And I guess that's not something that I've seen in years past. I think that we're at, in many ways, we're at an all-time low. In many ways, we're at that crucifixion piece, and we're if not, we're on Calvary, if not being crucified yet. But I mean, we can use a resurrection, and to see the multi-ethnic, multi-generational, to read the signs is something that just it was unique and refreshing for me. I've become somewhat cynical as a church bureaucrat that things are going to be this way till Jesus comes back. But I mean, I'm seeing signs of hope, and I think we're a hope-filled people.
Thank you for that.
Yeah, it's beautiful.
I'm going to put in the chat box real quick for anyone who is interested in taking some specific steps. We've got a resource for Catholic resource for racial justice that has specific documents that were mentioned here tonight, including the bishop's statements, but it also has a wide range of articles, webinars, features, everything from Ibram Kendi and some of the secular anti-racism literature to M. Sean Copeland and James Cone and some of these faith perspectives. So for people who want to take this work on in your local community and want to continue to educate yourself, as Dr. Shawnee said, and we also want to invite you to our final session tonight. Has been number 3. Our final session, which I'm going to share with you right now, is on reconciliation, reparations, and racial justice in healthcare. What do Catholic institutions O. And we want to be very intentional about using that word reparations because we who are Catholic, we have a sacramental theology of reconciliation that involves penance and atonement. And so myself here, a graduate of Georgetown University, my alma mater, that enslaved human beings and has a medical school and has a theology department and exists in large part due to that history of having sold enslaved human beings. What would reparations look like? What would reparations look like for a Catholic institution like Loyola Chicago? What would reparations look like for wealthy white parishes that have benefited from redlining and things like that? So we really hope you'll join us next week because it's going to be another great conversation. It will be moderated by our collaborative organizer, Jessica Simpson, the co-founder of White Coats for Black Lives. And we again want to thank our panelists tonight, Dr. Shawnee Daniels-Sykes of Mount Mary University and Ralph McCloud of the Catholic Campaign for Human Development. Thank you to both of you for being here. This was a great conversation.
My pleasure. Thank
Thank
you.
you. Thank you for having us.
My pleasure.
Yep. Bye.